Today, I'm pleased to announce that the Serum Institute of India has given us permission to make public an announcement, a public announcement, and start engaging with all the relevant stakeholders in preparation for the rollout. In our presentation, we also stated that as a country, we've estimated 1.25 million of health workers, both for public and private sector, need to be prioritized. It is for this reason that today we announce that South Africa will be receiving the first 1 million doses of vaccine in January and another 500,000 in February from the Serum Institute of India. As recently as yesterday, our teams at the National Department of Health and the South African Health Products Regulatory Authority were fine-tuning and aligning all the regulations, processes, the regulatory regulations and processes to ensure that there are no unnecessary delays or regulatory impediments to activate this rollout. We are all happy that the Serum Institute of India and AstraZeneca vaccine has already been approved by various regulators and is being rolled out in other countries. Therefore, as part of expediting the regulatory process, SAHPRA is applying reliance on that regulatory framework. We also want to inform the public that the acquisition has been done directly by the Department of Health. This strengthens the credibility of the process as all negotiations and payment issues are managed directly by government with other manufacturers. The reality that to deal with this issue, the only major source of protection is going to come from the vaccination program. And we believe that in South Africa, if it was possible, everyone should actually have the vaccine. But in terms of our current calculation, you need a minimum of 67 to 70% of the population to be immunized so that you can break the cycle of transmission. That is what we call the herd immunity, and that is based on a calculation that is made by scientists on the basis of the transmissibility of the virus in terms of how many people each person can be able to infect, as well as the various other factors that have got to be looked into to calculate what would be the safest number of people that would limit the spread of the infection. The vaccine will be voluntary. We'll try and urge as many people to take the vaccine, but vaccines are actually not mandatory. We just need the community to understand that it's for their benefit, and therefore they need to participate at that level. So where there are issues that relate to moral, ethical, or religious objections and those kinds of issues, we can deal with those at the time when we meet those situations. But where we are, the vaccines are going to be offered, really more for the common good of all, and therefore we're not going to be, they're not going to be mandatory to anyone, but we will actually like to see everyone taking up the vaccine. Actually, the vaccines do work, and it's not the only one on COVID. We dealt with that on polio, on tetanus, on what's called measles, etc. And so all of these, they actually help to save the community from kind of infection. The acquisition of vaccines will be funded largely from the fiscus. We have accepted that there will be support that will come from private sector in terms of business and donors, also in terms of medical aid. But government is not relying on charitable sources. We have actually got the fiscus to carry this, and this would have been the response that the Minister of Finance would have given at the time if he had been here. We're not at liberty to release any kind of figures here. All I can say is that between us and the Department of Treasury, the funds we need to raise to purchase, to procure the vaccines will be made available. And so it's a matter of how we deal with the details.